Good morning. Happy Monday. It's Nurse Eunice with Florida Training Academy, and we're going to review some CNA practice questions to help prepare you for your upcoming nursing assistant exam. We'll give you about 10 seconds to get your notifications, and then we will get started. Welcome, everybody. All right, so here we go. Question number one. With which chronic illness often requires dietary restrictions related to fluid intake? Is it A, chronic obstructive pulmonary disease, B, congestive heart failure, C, rheumatoid arthritis, or D, Alzheimer's disease? And if this is your first time joining us, get pen and paper. You will learn a lot. And feel free to enter your answer, your responses, or any questions you may have in the comment area. All right, so Anna says A, Sophie says B, Felix says A. We'll wait for a few more responses and then we'll reveal the answer. Balesi says B, Farida says B. Everybody, the correct response for number one is B as in boy, congestive heart failure. So CHF often leads to fluid retention because the heart isn't able to pump, the heart is congested. So clients with CHF typically require fluid restrictions in order to prevent fluid overload. Great job, everybody. Number two, when caring for a resident with a catheter, what is essential for preventing urinary tract infections? A, empty the drainage bag once a day. B, keep the drainage bag below the level of the bladder. C, use soap and water to clean the catheter. D, change the catheter weekly. And I am so proud of you. So many of you are saying B. So even though cleaning the catheter can prevent, infections, the main thing that you want to do, because you only clean the catheter maybe, excuse me, you only provide catheter care once per shift, is you want to do B. You want to keep that drainage bag below the level of the bladder because if you raise that bag, the urine can backflow and the old urine can go directly back into the bladder, thus causing a UTI. Number three, what is the proper technique for using a mechanical lift to transfer a resident from bed to wheelchair? A, position the resident on the lift and push. B, lift the resident by the arms. C, use a gait belt for support. D, follow the lift manufacturer's instructions. I know this one's tricky. Farida says D, Anna says D, Anna K says D. Anyone else? Celestina says D, Brenda, Sophie. So, everybody, you're correct. It is D. Don't go by what someone told you when it comes to using these lifts. Usually, they're going to have a video or some type of instruction manual. I don't care how short staffed your facility is, whenever you're using a mechanical lift, it requires two people, one person to operate the lift, the other person who actually has a hand on the patient who is hoisted in the air by the lift. So read the instructions, follow them, and use two people. Number four, what is the best way to provide perineal care for a female resident? A, wash from back to front. B, wash from front to back. C, use the same part of the washcloth for multiple strokes. D, use cold water. Yes, you are absolutely correct. We always clean from front to back. We clean from the cleanest area towards the dirty area. And this helps to prevent the spread of bacteria from the anal area to the urethra. So we wash front to back, clean to dirty. Number five, how often should a CNA check a patient's skin condition? A, once a week. B, daily. C, only when the patient complains of discomfort. D, monthly. This is an easy one. Absolutely. I didn't expect for any of you to get that one wrong. It is B daily, more specifically, every shift. Every shift, you should be doing this skin assessment, which is why we bathe our patients. Because sometimes your patients haven't urinated on themselves, they don't smell, but you being a good CNA and getting in there and giving them a bath or helping them to wash up is going to let the nursing team know if there has been changes to their skin, and it's going to help us address skin issues early. Number six, when assisting a patient with dressing, what should the CNA do first? A, ask the patient to choose their clothes. B, put on the patient's socks. C, assist the patient with putting on their pants. D, button the patient's shirt. And if you answer this one right, you'll pass the Florida CNA exam. So I see Anna says A, Wesley says A, Anna K says A. Yes, you want them to participate in their care. You just don't want to start addressing them. You want to actually engage with them and ask them to choose their clothes, ask them about their preferences. Number seven, which type of bath is most appropriate for a patient who is bedridden and has significant mobility limitations? Is it a tub bath, shower, partial bed bath, or a sitz bath? And the crowd goes, wow, because you all are providing awesome patient care. Yes, we are not going to submerge a person who is bedridden in water. We're not going to put a bedridden person in the shower. We're going to do like little spot baths. We're going to do partial bed baths. Usually night shift may have enough time to do a complete bed bath, but if you're on busy day shift, you hit the important parts and you keep on going. So a partial bed bath allows for cleansing while minimizing the need for patient movement. Number eight, how should a CNA handle a patient's dentures when cleaning them? A, clean them in hot water. B, use hot soapy water. C, use a denture brush and denture cleaner. D, rinse them with alcohol. Those dentures are expensive. How do you want to maintain them? How do you want to clean them? I'm nodding my head in agreement, everybody. So Brenda, Wesley, Anna, Alaranque, Bunja, you all are absolutely correct. And I'm going to pronounce this name, Sindala. I hope I said that right. Great job. We're going to use a denture brush and denture cleaner in order to properly clean someone's dentures without damaging them. Number nine, what is the correct way to perform nail care for a diabetic patient? A, file the nail edges with a nail file. B, soak the feet in hot water before trimming. C, use fingernail clippers to cut the nails. D, trim the nails very short. Oh, I think I finally got you on one. I haven't seen the correct answer yet. Great job, Anna. You were the first one to give the correct answer. You all, as a CNA, you don't use fingernail clippers. You never want to put a diabetic's foot in hot water because they have decreased sensation. They won't be able to feel it. They could actually get burned. So the correct response for number 9 is you can file nails, but that is it. So, filing the nails help to prevent jagged edges and injuries, which is particularly important for diabetic patients because if those nails are jagged, they can scratch themselves, which could cause a nick, and that could lead to an infection. I put it there in green. Nursing assistants are not allowed to clip nails. Look, you all have enough to do. If somebody needs their nails clipped, you're going to notify the nurse, and the nurse is going to notify a doctor, and the doctor who takes care of people's feet is called a podiatrist. We will get a specialized person who gets paid the big bucks to come in and maintain someone's toenails. Number 10, which of the following vital signs is measured using a sphygmomanometer? Is it A, pulse rate, B, respiratory rate, C, blood pressure, or D, temperature? All right, and if you haven't pronounced that word, I want you to try it. You can go to Google. You can do Google pronunciation anytime you can't pronounce yet a word. But when you see that long word, sphygmomanometer, we're referring to you taking someone's blood pressure. So yes, blood pressure is measured using a stethoscope and that blood pressure cuff, which is also referred to as the sphygmomanometer. Number 11, which of the following should a CNA do if a patient refuses personal care? A, force the patient to comply. B, respect the patient's wishes and report the refusal to the nurse. C, ignore the patient's refusal. Or D, offer a different type of personal care. Brenda, Anna, Guy, Anna K, Farida, Christiana, Booja. Of course, you know what to do. It is B. Respect the patient's wishes and report the refusal to the nurse. Find out why this person didn't want their bath. Maybe you are bothering them when The Price is Right is on. I don't know if it still comes on, but maybe their favorite TV show is on, and you bop your butt in there and it's like, hey, Miss Mitchell, it's time for your bath. She says no. You'll ask, what is a better time for me to come back? Now go notify your nurse and document that in the chart. Patient declined bath, nurse made aware, patient asked me to return at 2 p.m. We'll reattempt the bath later. That way, when her family member comes in at 8 p.m., and now Mrs. Mitchell is like, that CNA never offered me a bath, you'll have documentation to prove that not only did you offer the bath and she declined, but you offered twice and that your nurse was aware. And that's really important. Number 12, when assisting a resident with ambulation, what should the nursing assistant check first? A, proper footwear. B, walking cane. C, ambulation belt. D, resident's mood. Do, 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 do. I see A's, I see C's, I see D's, I see A's. So, everybody, for this one, let's talk about those residents. They're not always nice. So if you're waiting for them to get nice and you're concerned about their mood before you walk them, they'll end up being bedridden because every time you go in, no, I'm okay. I don't want to go for a walk. So it is not D. It is not their mood. It is going to be, hey, Miss Mitchell, we have an order to get you up. Let me make sure that we have proper footwear. You want to put those shoes on their feet. And if you don't have shoes, Hopefully, they have the socks with the little skids on the bottom. Those are the slip resistant socks. Just make sure that the slip resistant part is actually on the bottom of the foot, because sometimes that sock can slide around, and the skid part is on the top. So you always want to check the feet before the patient get out of bed to make sure that those anti-resistant skid areas are on the bottom of the foot. Number 13, which of the following terms means abnormal enlargement of the liver? Is it hepatitis, nephritis, hepatomegaly, or gastritis? You can tell when Nurse Eunice hasn't had her morning cup of coffee. These words are not slipping off my tongue the way they should. Yo, Guy, Alice, yes, you all have it. Sue Hale. So the term is hepatomegaly. So let's go back. Anything that has itis at the end refers to inflammation. So it's not hepatitis, that's inflammation or infection of the liver. It's not nephritis because that would be inflammation or infection of the kidneys. So hepatomegaly. Anytime you see the term megaly, that means that an organ is enlarged. Okay, so hepatomegaly refers to the abnormal enlargement of the liver. 14. When providing catheter care, the CNA should A. Clean the catheter tubing with betadine. B. Avoid touching the catheter at all. C. Clean the around, I think it should say, clean the area around the catheter insertion site with soap and water. D. Use antiseptic wipes only. Give you a few seconds and then we'll check your responses. Anna, I'm so proud of you. You usually always get the answers correct. So I'm happy in this video you learned something new. So we have C's. I saw a D. Do not use antiseptic wipes near anyone's private area. That's going to burn. So the correct response is C. You're going to clean the area around the catheter insertion site with soap and water, mild soap and water. Clean the area helps to prevent infection. I'm happy that none of you chose betadine because betadine can irritate and damage the skin. So normally we'll only use betadine or iodine if we are prepping an area. So whenever the nurse is going to insert a catheter, she would use the betadine or the iodine and then wipe it off. We don't want to leave anything that could damage the skin on the person's skin. So even with the soap, after you get the washing, make sure you rinse it and then dry the area carefully. And for the state of Florida CNA examination, when you're providing the catheter care for the skill, you have to make sure that you clean the private area or the vagina and the catheter. So it's wash, wash, rinse, rinse, dry, dry. Wash the vagina, wash the catheter. Rinse the vagina, rinse the catheter, and then dry them both. Number 15, what is the recommended technique for providing mouth care to a patient with dentures? A, soak the dentures in mouthwash overnight. B, clean the dentures while they are still in the patient's mouth. C, use a cotton swab to clean the dentures. D, remove the dentures and clean them over a sink filled with water. And if you haven't downloaded your free study guides or your free practice test, go ahead and go to our website, which is fltraining.com. And on the home page, under additional resources, you should see the Prometric and the NNAAP practice test as a downloadable link. All right, we're going to be revealing the answer in 3, 2, and If you chose D, you're absolutely correct. You're going to remove the dentures and clean them over a sink filled with water. So you could either fill the sink with water or put like a washcloth in the base of the sink, because we know when dentures come out of a resident's mouth, they are slippery. They have saliva, they have food particles, you have the gloves on, and if they hit the insides of the sink, those dentures could break. So you're going to use cool water, not cold, not hot, because we don't want to reshape the dentures. You're going to either have a sink that is filled with water, not for you to place the dentures inside of the water, but in case the dentures slip out of your hands, they're going to hit the water and not the actual sink itself. And for your CNA test, you can also accomplish that same goal of protecting the dentures by putting a washcloth at the base of the sink. Number 16, in what order should a CNA wash the different parts of a patient's body during a bed bath? And because that's so much, I'm not going to read it. I'm going to allow you to read it. Tell me what the answer is. Yes, Michelina, it is FL as in Florida, training.com, and I've put it in the chat. Everybody knows to start with the cleanest area, which is the face. Yes. So we always start wiping from the cleanest to the dirtiest. So it's going to be face, arms, chest, legs, back, peri area, which is the private area. And if you have limited washcloths, you're supposed to, change spots every time you're washing the genital area. So then after the genital area, get a new washcloth, and then you can clean down to the legs and the actual feet. Number 17, if a patient has a myocardial infarction, what condition have they experienced? Is it a stroke, heart attack, seizure, or pneumonia? Yes, Michelle. Yes, Farida. Anna. So if you have chosen, because I have a lot of responses coming through, if you have chosen B, heart attack, you know that myo refers to muscle, cardio refers to the heart, and infarction, the tissue has died. So when the heart tissue dies or the person experiences lack of blood flow to the heart, that is also referred to as myocardial infarction or a heart attack. 18, when assisting a patient with toileting, the CNA should A, leave the patient alone for privacy if the patient asks. B, stay with the patient if they are at risk of falling. C, allow the patient to use the bathroom independently, regardless of their condition. D, provide assistance only if the patient asks for help. Well, I hope that you are extremely proud of yourself for being a very safe caregiver. I'm proud of you. If I had enough jobs, I would hire all of you all, because you're not going to let those boogers trick you. When the patient's like, leave me alone, but you know they're at risk of falling, you do. B, you stay with them. You do not leave them, even if they don't want your assistance. You just stay right there. So stand with the patient if they're at risk of falling, ensures their safety while maintaining as much privacy as possible. So, Miss Lucas, I know that you don't want me here. I'm just going to stand right here at this door, and that way I'll be able to check on you and come back and assist you back to bed. So you don't have to stare at them. You can either turn away or just stand at the doorway. Of course, not facing the bathroom. That gives them privacy, but it also gives them the support they need to prevent them from falling. Number 19, if a patient is described as ambulatory, what can be inferred about their condition? A, they require a wheelchair. B, they are bedridden. C, they can walk and move around. D, they need assistance with standing. So, when someone is ambulatory, see, they can walk and move around. So, an ambulatory patient can walk and move around with or without assistance. And I think that's why, Karen, you chose D, because sometimes they have to ambulate with a gait belt, sometimes they ambulate with a walker. But either way, this person has leg strength. So, someone who is ambulatory can walk and move with or without assistance. Please check the patient's plan of care to view their activity orders. Because if it says walk with a walker and you see Miss Lucas just up in her room without that walker, she's probably going to fall eventually. She's just having a really good day. So always remind her, hey, Miss Lucas, here's your walker. I see you forgot it, and take her right in the bathroom with her. 20, what should be encouraged in the diet of patients with anemia? Is it iron-rich foods, high sodium foods, dairy products, or processed meats? Marcia, Adair, Talisha, Augustine, Karen. Oh, that was so easy. It is iron-rich food. So, encouraging iron-rich foods helps to address the underlying cause of anemia. So, iron deficiency anemia occurs when the body does not have enough iron. And don't forget, iron is really important because it helps to create red blood cells, the blood cells that circulate, that have oxygen. So, that is why when people who are anemic, they're like, I'm always cold. Sometimes they're really sleepy because they don't have any red blood cells, they don't have any oxygen. So, iron can come from meats, it can come from plant sources like spinach and beans. So if they, let's say they're a vegetarian, they don't have to eat organ meats. They don't have to eat liver to get their iron level up. They need to be eating some beans and also some spinach. 21, you're feeding a patient with dysphagia. Which item should not be given to this patient? Is it food thickener, thin liquids, parade foods, mashed potatoes? Oh, if you haven't subscribed, please do so. Also, like the video, it helps us with the algorithm. It helps to push our content out to future healthcare providers. We provide so many free resources, CNA, CPR, even nurse prep videos. So go ahead and give it a like, give us a thumbs up, and share our content with others. And we will reveal the answer in 3, 2, and so if someone has dysphagia, they're having a hard time swallowing. So normally the speech therapist has come in and done his or her evaluation. They're going to determine how thick their foods have to be. There's going to be a canister, a can of food thickener in their room. So yes, a person with dysphagia is going to have food thickener. You're going to add that, mix it in with their liquids. They may also be prescribed pureed foods. They can also eat mashed potatoes because it's thick enough. It's soft enough for them to swallow it without it going into their airway. So, what you don't want to give them is B, thin liquids. Thin liquids can be difficult for patients to swallow, increasing the risk of aspiration. So, your speech therapist will determine if they need nectar thick, honey thick, and you thicken those liquids up so the person can swallow them. And that way, the liquids go into their esophagus and their stomach versus the trachea in their lungs. 22. What is the primary purpose of the RACE acronym in fire safety? And that's a lot to say. So I'm going to let you read it and then tell me your response in the comment area. Everybody has the correct response. I'm so proud of you. And it is B. We're going to race. We're going to rescue that patient, get them out of harm's way, get yourself out of harm's way. We're going to then pull the fire alarm or call 911. So you rescue the person before you call for help. C, close off the fire, confine it. So shut the door. Most of your facilities have doors that have fire ratings where, like, this door will keep flames out for at least an hour. So close the door, confine the fire. And you can either evacuate, leave the entire building, or if you have a small fire and a fire extinguisher, you can extinguish the fire. So E stands for one or of two things. So the RACE acronym is used to remember the steps to take during a fire emergency. Number 23, what is the role of teamwork in dealing with difficult patients in a healthcare setting? A, minimize collaboration to avoid conflicts. C, work independently to assert individual authority. C, collaborate with colleagues to develop effective strategies. D, compete with colleagues to gain recognition. So you're working in the psych unit, and this patient is doing what psych patients do. How do you want to deal with your coworkers and deal with this patient? Yes, Paulette, we do offer online CNA classes. If you go to our website, fltraining.com, you will see the link. Yes, you all want to collaborate. So let me tell you a story. My first day as a charge nurse in the psych unit. We hadn't been taught, we had not been taught our takedown skills just yet. And there was a probably 190-pound man who's about 6 foot something. He's walking around toting a sign saying that he is part of the Taliban. He's not bothering anybody. He's just walking around. And a male tech says, if you don't calm down, I'm going to restrain you. You all, it took 5 of us to handle that one man because that team member did not use effective communication. You never warn anyone that you're going to take them down. And plus, if they're not being valid, there is no reason to take them down. So be careful with what you say. Never warn the patient that you're going to restrain them because it's going to take an act of Congress and all of your team members to help you to accomplish that goal. And plus, again, we usually don't restrain people if they are not being a danger to themselves or a danger to others. That needed effective communication and de-escalation tactics, not testosterone versus testosterone. So sometimes just take yourself out the picture and let your nurse deal with it. Number 24, what is a critical consideration when assisting a patient with eating? A, allow the patient to eat quickly. B, check for dietary restrictions and allergies. C, feed the patient as fast as possible. D, only provide liquids. I know everyone's going to get this right. This one's easy. Bree, I'm so proud of you. Everyone congratulate Bree. She passed both of her CNA exams, her written and her clinical. So Bree, congratulations. Yes, everybody, the dietary restrictions and allergies. Don't give a diabetic patient a tray that has concentrated sweets. Don't give a patient with cardiac disease a tray that has processed foods and a lot of salt. And then, of course, if someone has an allergy, don't give them anything they're allergic to. So again, congratulations, Bree, and to anyone else who has recently passed their CNA test. 25. When is the best time to perform personal care tasks for a patient? A, when the CNA has time. B, only in the morning only. C, late at night only. D, according to the patient's preference and routine. And if you've been here for any part of this video, you should know the answer to this question. Yes, we don't own them. We work with them. We're going to work with them in their schedule. And the correct response to D, excuse me, to 25 is D. Performing personal care tasks according to the patient's preference and routine, respects their individual needs, and promotes comfort. Well, you all, I have great news. The reason that I have not been putting out as many videos as lately is because my last administrative assistant, Tynesha, she went off to college, so she has a whole new focus. But today I get 3 new summer workers, so I need to give them some work to do today, you all. So what test do you want me to have them create for this week? If you have any suggestions, just go ahead and put them in the comment area. I know someone wanted a plan of care. Just my schedule has not allowed me to create a video on how to complete a plan of care yet. But is there a specific concern? Is there something, a disorder your family member has? Is there something you've seen a patient with? What do you want this week's videos to be about so I can get those summer workers to help me complete those presentations today? All right, I need some suggestions. Anna says infection control. Medical abbreviations, and that'll be good for them too because they can learn all about that. How to care for a pressure ulcer. Okay, we got our 3, Anna, Bree, Nikisha. And so everybody, I want to say great job. Thank you all for watching. You all are amazing. You're amazing caregivers, amazing future caregivers. And I do not know the upcoming schedule. You know me, I get on here whenever I get a chance, but we will start working on those videos today. Have a great day, everybody. Happy Monday.